Let me begin with something that may change the way you think about health forever. What if the majority of chronic diseases we see today, heart disease, diabetes, autoimmune conditions, even neurodegenerative disorders, share one common underlying driver? Not genetics alone, not aging alone, but chronic unresolved inflammation. Inflammation is not the enemy. In fact, without inflammation, you would not survive a simple cut on your finger. If you injure tissue, your immune system responds immediately. Blood vessels dilate, white blood cells rush to the scene. Chemical messengers coordinate repair. Swelling, redness, warmth, these are signs that your body is healing. Acute inflammation is protective. It is intelligent. It is necessary. The problem arises when inflammation does not turn off. Chronic inflammation is different. It is low-grade, persistent, and often silent. You may not feel it directly, but internally it can disrupt blood vessels, impair insulin signaling, alter brain chemistry, and stress your immune system. Think of it like a small fire that never fully extinguishes. Over time, even a small fire can weaken the structure of a building. So what keeps this inflammatory fire burning? One major factor is poor metabolic health. When blood sugar levels remain elevated, glucose molecules attach to proteins in a process called glycation. This damages tissues and increases oxidative stress. Insulin resistance develops, and inflammatory pathways remain activated. The encouraging news is that metabolic health is highly responsive to lifestyle changes. Regular physical activity increases insulin sensitivity. Even a brisk 30-minute walk can reduce inflammatory markers. Resistance training improves mitochondrial function, the energy engines inside your cells, reducing oxidative stress. Movement is medicine, not metaphorically, but biologically. Another powerful driver of inflammation is sleep deprivation. During deep sleep, the body undergoes repair. Growth hormone is released. Immune cells recalibrate. The brain clears metabolic waste through a specialized system known as the glymphatic pathway. When sleep is shortened or fragmented, inflammatory markers such as C-reactive protein and interleukin-6 increase. Natural killer cell activity declines. The body loses its nightly repair window. Protecting your sleep may be one of the most potent anti-inflammatory strategies available, and it costs nothing. Stress also plays a critical role. Acute stress can be adaptive. It mobilizes energy and sharpens attention. But chronic psychological stress keeps cortisol elevated. Over time, persistently high cortisol disrupts immune regulation, increases abdominal fat storage, and amplifies inflammatory signaling. Your nervous system and immune system are deeply connected. When the sympathetic fight or flight system is constantly activated, inflammation tends to rise. Practices such as slow, controlled breathing, time in natural sunlight, social connection, and regular exercise help shift the nervous system toward parasympathetic balance, the rest and repair mode. That shift is measurable in heart rate variability and inflammatory biomarkers. Let's talk about nutrition. Highly processed foods rich in refined sugars and industrial seed oils may promote inflammation in susceptible individuals. Diets lacking fiber reduce beneficial gut bacteria. And your gut microbiome plays a powerful role in immune regulation. That trillions of microbes in your intestines produce short-chain fatty acids like butyrate. These compounds strengthen the gut barrier and reduce systemic inflammation. When the gut barrier is compromised, inflammatory molecules can enter circulation more easily. Supporting gut health through fiber, rich vegetables, fruits, legumes, and fermented foods may reduce inflammatory burden. Food is not just fuel. It is biochemical information. Then there is body composition. Excess visceral fat, the fat stored around internal organs, is metabolically active. It releases inflammatory cytokines that can affect the entire body. Reducing excess body fat through sustainable lifestyle changes often lowers inflammatory markers significantly. Importantly, this is not about extreme dieting. Severe caloric restriction can increase stress hormones and sometimes worsen inflammation. Sustainable, balanced approaches work best. Hydration also matters. Even mild dehydration can increase physiological stress and influence circulation. While it may seem simple, consistent water intake supports cellular function and metabolic processes. Sunlight exposure plays a role as well. Moderate sunlight helps regulate circadian rhythms and supports vitamin D production, which influences immune function. Low vitamin D levels have been associated with increased inflammatory activity in some populations. We should also acknowledge environmental factors, air quality, smoking exposure, sedentary lifestyles. Each of these contributes incrementally to the inflammatory load. When we say inflammation is the root cause of many chronic conditions, we do not mean it is the only cause. Genetics matter. Environmental exposures matter. Access to healthcare matters. But inflammation is often the common pathway through which many risk factors exert their damage. Here is the empowering truth. Inflammation is dynamic. It is not fixed. You can influence it daily. Through sleep, through movement, through nutrition, through stress regulation, through maintaining healthy social relationships. Small, consistent actions compound. You do not need perfection. You need direction. Imagine lowering your inflammatory load gradually over months. Blood vessels become more flexible. Insulin signaling improves. Energy production becomes more efficient. Cognitive clarity increases. Recovery after exercise improves. The body begins to shift toward equilibrium. This does not mean disease disappears overnight. It means the internal environment becomes less hostile and more supportive of healing. Modern medicine remains essential. There are times when medications, targeted therapies, or surgical interventions are life-saving. Anti-inflammatory drugs have their place, but long-term resilience requires addressing the upstream drivers. If you focus only on suppressing inflammation without addressing its causes, it is like silencing a smoke alarm while the fire continues. Instead, we must ask, what is fueling the fire? Is it chronic sleep restriction? Is it persistent stress? Is it poor metabolic health? Is it nutrient deficiencies? Is it lack of movement? When you identify and gradually correct these, you reduce the signal that tells your immune system to stay activated. The goal is not zero inflammation. The goal is appropriate inflammation inflammation that activates when needed and resolves when the job is done. That is physiological intelligence, and your body is designed for it. If you remember one message from today, let it be this: your body is not randomly breaking down. It is responding to inputs. Change the inputs, and you often change the outcome. Destroying inflammation naturally does not mean attacking your body. It means supporting the systems that keep it balanced. Protect your sleep as if it were medicine. Move your body daily. Eat in a way that nourishes your cells. Breathe deeply and regularly. Prioritize meaningful human connection. Over time, these actions lower the inflammatory burden and restore resilience. The most powerful anti-inflammatory tool is not a pill. It is an environment, an internal environment you help create every day. And when that environment shifts toward balance, healing becomes possible. Not because of hype, not because of wishful thinking, but because of biology.